Kashekulena re mona sepataleng sa Universitas Academic Hospital. Ke mona morne re tlotla bula extension ya rona ya di field hospital. Hore re eketse dibethe tsa bakudi ba rona ba tla bana le mthata ba COVID mona province. Joale re mona le premier wa rona wa Freestata, MEC wa rona wa health le MEC wa police roads and transport. Le basebetsi mo ba lefapha go tlotla bula mosebetsi ona o motle re na le dibethe tse ka etsang 103 ka mane ka fatshe ka mone le garage re na le dibethe tse ka etsang 30 kapa tsona ditulo lazy boys that you saw tse ka etsang 30 ka mane ka critical care.
As you can see here, there's no curtains, there's no screens, it's an open plan. The reason we have this is it's for ease of nursing. So we need the patients to always be able to be observed by the sisters. And if there's no screens, it actually decreases the number of nursing staff that are needed and also cuts costs without compromising on patient safety as well. So this unit that you see here is the first of its kind basically in South Africa. And we're using these units, we call them the Oxidus 1 and Oxidus 2. I'll explain exactly how they actually work. And these ones, we're going to start off, as you can see, with 20 patients. And as they need a rise, we can expand to 60. And these chairs are designed to actually have the patients sit down and actually recline as needed. All the equipment that you see here will later be repurposed after the pandemic to other units where they need, like dialysis units and then oncology units as well. And these ones can actually go to other ICUs where they actually needed. The monitors can also go to wards where they will be needed after the whole pandemic passes as well. And then I would like to report that 100% of the equipment and the 90% of the expenditure has already been allocated for this pandemic, post-pandemic phase.
Today we are setting yet another historical milestone in the efforts of the Free State government in the fight against COVID-19. The disease is dreadful. It came as a shock, caused panic and frustration to all of us as the Free State communities. So was the case with the rest of the world. Our fight is not easy. However, we are combat ready to face the enemy head on. What makes matters worse is that we are fighting with an invisible enemy with glistening tactics. When we are convinced that we are about to understand the modus operandi of the virus, it changes its tactics, and we see the spiral increase in the number of the infected people. As of the 7th August 2020, the Free State had 26,877 confirmed coronavirus cases. We were standing at 760 new cases per day, which is still unacceptably high and worrisome. We are striving for 0 infections per day. The provincial breakdown per district was as follows. Mangaung was standing at 10,543, Lejoleputswa at 6,946, Thaba Mfutsanyana at 4,271, Fezile Dabi was standing at 4,164, and Arip was at 938. Bloemfontein in Mangaung is still topping the rest of other areas in the province with 8,440 confirmed cases. Inasmuch as the Universitas COVID-19 ward is going to cater for the whole province and beyond its borders, due to high number of confirmed cases in Bloemfontein, it makes sense for us to increase our bed capacity in this area. This will help us to provide care for those in need of hospitalization and in need of the hospital care. The fact that COVID-19 ward we opened today is in the premises of Universitas Academic Hospital has the advantage of patients being within reach of highly skilled clinicians and also high-tech equipment available at the hospital, at their disposal. This will further increase the chances of research and improve our knowledge base in better understanding the behavior of the virus, and perhaps contribute in finding the vaccine. Who knows, this may be the beginning of finding the everlasting solution to the problem. HOD, we remain optimistic and share the vision of us emerging as victors at the end of the battle. We are convinced that one day we shall overcome the COVID-19 pandemic, and it will pass like many other pandemics did in the past.
I'm very excited. And I really feel Batwa Free State, they are not aware how lucky are they. Just for us to have CUT, to have UOFs, to have the Department of Health that are so committed to make sure that they fight this virus. Commitment yabona, it's just amazing. I'm very excited and I'm very happy, and I can say it very proudly, Batwa Free State are in good hands and they are safe. We have 8 beds today. Oxygen that was made to students from Universitas, and everything is fine. And today we have even appointed extra nurses, extra doctors. It is just amazing. Ka nnete ya nnete modimo o na le rona, ha fela batho ba bo rona ba ka re thusa ka hore ba dule ba hlapa matsoho, ba keep social distancing, ba dule ba rwetse di mask, ba dule hae, ba ske ba tsamaya ho sa hlokahale. Ke a hlapanya yena ntwa re tlo e hlola. Modimo ke a leboha.